It's just amazing the unlocks you can get when you have somebody laying eyes on a patient while they're in the home setting. There have been just amazing stories of recognizing that the real problem here was the lack of a shower chair or the lack of the carpets being tacked down, or this patient could really use better stairs in the back of the house because the stairs, a little bit of work on those stairs would reduce their fall risk immensely. And so those types of unlocks, when you're really looking at the patient at home, are things that a pure clinic-based model will never see.
New choices, new players, new models of care. You know consumer-first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer-first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 357. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about Humana's new research on senior-focused primary care. What does the study tell us about the benefits of senior-focused care, and how can it inspire us as we design consumer-centered healthcare services? I'll talk about that. Then we're honored to welcome the president of CenterWell at Humana, Dr. Sanjay Shetty. He covers a lot of ground, from the little things that make a big difference in patient engagement to the big announcement about CenterWell at Humana leasing space in former Walmart health clinics. You wanted awesomeness on this show, and you're getting more awesomeness today, folks. So it's time to dive right in. Are you ready? Let's go.
Flava of the week.
Humana continues to strengthen the case for care model innovation. According to a press release, a new study from Humana Healthcare Research and Harvard University revealed better access to primary care for seniors receiving care from senior-focused primary care organizations compared to other types of primary care organizations like the traditional fee-for-service model. In the study published in the September issue of Health Affairs, analyses of data from more than 462,000 Medicare Advantage beneficiaries in 2021 showed that senior-focused primary care organizations served more Black and dual eligible beneficiaries than other primary care organizations, and regression-adjusted analysis showed that senior-focused primary care patients received 17% more primary care visits. These findings suggest that risk-bearing organizations in Medicare Advantage are responding to current payment dynamics and providing enhanced care and access to patients, particularly historically underserved populations. So now we have more evidence to support care model innovation, especially for seniors, which is encouraging because I have yet to see any well-reasoned rationale for not innovating in value-based and population-based payments. We've spoken with several guests over the years who practice in senior-focused care models, and they've unanimously agreed that it's good for their patients and society at large. But why specifically, you ask? Back to the press release. Today's primary care healthcare system often fails to meet the needs of seniors, many of whom have chronic conditions and complex care needs. The traditional primary care system that primarily operates in fee-for-service arrangements with insurers can be difficult to access and is often more reactive than proactive. Alternatively, senior-focused primary care organizations operate within a value-based care model supported predominantly by population-based payment contracts with Medicare Advantage. This payment arrangement, enabled by current CMS payment policies, provides the infrastructure, flexibility, and financial incentives for senior-focused primary care organizations to provide tailored, holistic, coordinated, and proactive care to older adults, particularly historically underserved populations. Senior-focused primary care organizations offer longer appointment times, same-day appointments when needed, and access to on-site teams of doctors, nurses, pharmacists, social workers, behavioral health specialists, and referral specialists who provide a wide range of extended services to meet the comprehensive needs of seniors. So that's why. And when I personalize this and think of who is taking care of my aging parents or other loved ones in their golden years, I want them to not only have the best care, but to feel confident in seeking that care. Because it's one thing for traditional sick care to claim that it offers high quality, and as Humana's study shows, it's quite another thing to actually prove it. Let's let senior-focused primary care inspire us as we design and build consumer-centered healthcare services. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
All right, everyone, let's get into the flow. What an exciting episode we have here. I want to welcome James Gardner back, our correspondent here. James, welcome back. How have you been?
I'm doing really well, Jared. I'm super excited to be back with you. And today's guest really excites me. As we'll get into it, obviously, demographics tell us that senior care is a really, really important thing. And we've got an expert in our midst that is doing some incredible work. So absolutely looking forward to the conversation.
Fantastic. Well, let's get right into it. Let's please welcome our guest today, Dr. Sanjay Shetty. He's the president of CenterWell. Dr. Shetty, welcome to the Healthcare Wrap.
Hey, thank you so much for having me. Excited to have a chat.
I'm going to echo what James said in terms of our excitement to have you on and dive into just some of the exciting things that are going on with CenterWell. Of course, we'll get into more in the background, but tell us a little bit about yourself first.
Sure. Hi, everyone. My name is Dr. Sanjay Shetty. I am president of CenterWell at Humana. CenterWell is Humana's care delivery and health services organization. Although I think the company's very well known for insurance, this has been a growing part of what we do at Humana to sort of try to improve healthcare for seniors across the country. So excited to get a chance to talk a little bit more about that. By way of background, I'm a practicing radiologist. I don't have much chance to practice these days, but was a practicing physician for many, many years, and also have a background in working in an integrated health system as well as in consulting. So my background sort of spans medicine and business.
Fantastic. Well, give us a layperson's description of CenterWell at Humana. Like, what are the specific problems that it's out there to solve in healthcare?
Yeah, absolutely. So, I would argue right now that healthcare is really changing, right? And we all know that if you have a parent or a friend who's a senior who's trying to navigate the system, healthcare is complicated. It's fragmented. It's difficult to navigate. And unfortunately, seniors are always frustrated by what they actually encounter, right? They're often dependent on family to navigate the system. In other cases, even themselves find it difficult because they're having difficulty even getting access to certain services. They're having difficulty figuring out what's the right next step. And it's a complicated population. And so CenterWell is really there to try to help patients bridge that gap. Our mission is to deliver on personalized and integrated care that improves experience, quality, and outcomes. And in order to do that, we've really sort of thinking about three big areas that we focus on as a company. The first is CenterWell Senior Primary Care. So we have around 300 clinics operating in 15 states across the country. Well, hopefully we'll get a chance to talk a little bit about what I think makes those primary care centers special. We also have CenterWell Home Health, which is one of the largest home health agencies in the country, operating 350 branches across 38 states. And we also have CenterWell Pharmacy. So we do mail order pharmacy for members. We also have a specialty pharmacy, a small set of retail pharmacies. And the goal for all putting those three things together is, although, it doesn't look like a traditional healthcare system in the way that you probably think about it, like having bricks and mortar hospitals around the country, we like to think of ourselves as a chronic care delivery system, where we're there to help seniors navigate what's otherwise a really complex and fragmented world. And basically, although we don't own a lot of what's going on in terms of spending, we are able to influence a lot of it, right? And so how can we work with our patients to help them influence their care journey, help them achieve better outcomes, better quality, and do so in a way that is aligned with the tenets of value-based care? So that's what makes it so exciting, because we're able to do things with respect to coordination and integration that you just can't see elsewhere.
I love that. And I think it's helpful to see those different areas and how they interrelate and understand what type of experience that sets up. And I'm curious just about what your thought is on the general state of senior care these days in terms of some of the either challenges or opportunities that are just like in the middle of that radar screen for you these days.
Well, I'll start with the challenges, because I think that's probably the basis from which CenterWell was founded. I mean, obviously, the senior population, we all know the senior population continues to expand, right? Right now, we have 55 million people who are over 65. I think that's expected to grow to 80 million by 2040. So this is a population that's going to need care. Even more importantly, this is a complicated population, as I mentioned, right? According to the CDC, 80% of seniors have one or more chronic conditions. 50% have at least two. I'm sure the statistics vary depending on where you look, but we're talking about a group of patients that is going to have real care needs, and are going to have care needs that are met in a longitudinal fashion, right? When you're young and you think about healthcare as transactional, that changes as you get older and you have chronic conditions, and you need to have somebody actually working with you on an ongoing basis. And so that's really complicated. And so for me, that's a difficulty. I think there's also the problem of access, right? So right now, we have one geriatrician for every 10,000 seniors in the US, right? And that's a situation that's only going to worsen over time. So we've got a complicated population, fewer people to care for them. And unfortunately, that gets worsened in certain parts of the country, right? So we also have this terrible inequities in access to care when we look at underserved and rural areas. And so a lot of patients are just facing these barriers, right, on the very basics of how they get into care. And then I think overlaying all of that, we've got a problem in that our traditional models of how we reimburse for healthcare are broken, right? Fee for service pays people more for how much they do, but not what they do or what kind of outcomes they deliver. So a lot of reasons where I could sit back and say, oh man, this is just broken and I need to run away. Luckily, CenterWell is sort of the mission of CenterWell is to try to fix that and sort of address all of those areas. So I'd say, right now, the state of the industry is that there's a lot of challenges coming up, but I'm also really excited about the fact that there are people seeing the problem and trying to get out ahead of it, right? By leaning into models that will help fix it. So I'm excited about what CenterWell has already started with. So just looking even at our CenterWell Senior Primary Care, we recently actually just published an article in Health Affairs earlier this month, which sort of looked at our model. If you have a primary care model that's focused on seniors and focused on value, what can you accomplish? And it was pretty cool to see what we were able to do, right? So looking at us and some of our other organizations that are like us that are really leaning into senior primary care, we're seeing better access to primary care visits. We're seeing reduction in some of those health disparities. We're seeing better health outcomes, right? So if you get into the nuts and bolts of more cancer screening, better blood pressure control, better medication adherence, and all of that leading to better outcomes, right? Fewer ER visits, fewer hospitalizations, fewer readmissions. So I'm excited. So I kind of see the challenge. I think there are a couple of folks who are out there trying to get at it. And we're starting to see some of the earliest proof points that these models can actually have an impact.
Can you describe the journey that a CenterWell patient might have? Like, does it begin with maybe Medicare coverage through Humana, or are there other paths into your system? And what might a stereotypical journey look like to get the care that you just described?
One of the important things about CenterWell is that, for example, within primary care and within home health, we work with all payers. So we work with Original Medicare, and we also work with other Medicare Advantage plans. And so although we are a part of Humana, we sort of see ourselves part of the broader solution to senior care, if you will. And so the typical journey for our patient is to come in through use of one of the particular businesses. Most commonly, it would be primary care or home health, where our goal is, again, to onboard those patients, to engage with them through visits, and then to sort of guide them through how they have to navigate healthcare beyond that. I think what's really exciting about, so if I just start, for example, with CenterWell Senior Primary Care, what's cool about the model is that we are able to see our patients typically 4 times a year, some less, some more, but we're engaging with our patients, and each time we see them, we're seeing them for longer, right? So typically 50% more time in the clinic, so 40-minute visits on average. We've built the clinics to serve our population, so even things like that you wouldn't think about, the non-slip floors, the exam tables that look more like chairs that can turn into exam tables for people who have trouble getting on and off an exam table. Every one of our clinics has community rooms where we're able to sort of develop a full set of programming. I'm sure we'll have a chance to talk about that as well. But that journey starts with, hey, this is what it means to be part of a senior-focused primary care that is focused on you and your health and wellness. It's going to feel different than the 7-minute visit where we deal with the problem that you have right then and we forget about everything else. It's going to look and feel very different. The other really cool thing about it is every one of our clinics has an entire care team. So part of that onboarding journey is you're going to meet your physician and meet the other providers who are directly taking care of you, but you're also going to learn about the behavioral health specialist, the community health worker, the social worker, the integrated pharmacist, the rest of that care team that is wrapped around you. And so that's what I really love about that. The beginning of that journey is you'll get longer visits. And what I love is that I've seen, and I've sat through visits just because I love to observe it, you get deep in 40 minutes, right? If you make it take care of the acute problem, but 2-3 visits in, you're talking about things like advanced care planning and end-of-life care and all of the other socioeconomic factors that are getting in the way of your health, your family concerns, things that are actually the barriers that may actually have a bigger role in why patients not getting their best health. And the providers have that time to go deep on those things. So that's what the journey looks like. And then we're with them every step of the way, right? So if they go to the hospital, they go to the emergency room, we're getting them right back in for a visit so that we're able to work with them on, hey, what happened there? How can we make sure we coordinate all the care that follows those? How can we make sure the medication regimen you're on still makes sense? So working with them through that journey is as they encounter other parts of the healthcare world, that we're bringing them back into the ecosystem in order to ensure that they're getting the care that they need.
I love that. I noticed you called out some things that maybe haven't always been part of traditional care. An exam table that somebody can get on, a community room, spending more time, like a longer visit. Why do you think those things are important? Why are those differentiators compared to how senior care has traditionally been serviced?
The reason that those things are traditionally not cared for, I think, is in the traditional model. You really don't have an incentive to take care of them, right? So in traditional fee-for-service, it's sufficient for you to take care of the acute problem at hand, typically in the context of a much shorter visit. But in the CenterWell model, we're really charged for caring for that patient in a longitudinal, long-term way. And therefore, we've built a model that allows us to care for patients like seniors who often have more chronic conditions, who have other barriers in terms of why they might not be able to access their care. And so this model of bring them into the clinic, bring them in often, find other ways for them to engage with our care teams, but also with each other is really important to sort of understanding the whole person care that we're trying to deliver. So I think that's a big part of why our model has been so interesting to explore and to continue to grow.
We're talking about ways that you engage a consumer in their health or a patient in their health. I mean, I think that's the common thread here, right? And that's the theme of this season for the podcast. Anything in particular in the way that you digitally engage a consumer in their health that's just interesting?
As we think about engagement, it starts with what I already described, right? Which is it's got to be personalized. It's got to be person to person. So I think that's really crucial, right? To give you that opportunity to engage. I think on the technology side, we're very much recognizing that the old sense of what a senior will do on technology is not true, right? The pandemic maybe accelerated this, right? Everybody figured out how to use their phones. Everyone figured out how to use their laptops. And so there's just this much bigger willingness to engage. So it starts with the very basic of things like telehealth, right? Where we're making sure that we have same day, next day access to our clinics for any acute needs that a patient might have, but also giving them opportunities through our digital platforms to take care of things that they traditionally would have had to call into the clinic to do, right? So making sure that they have the ability to take care of their common care needs, which is a pretty common thing, but scheduling that visit, refilling your medication, getting the referral, all of those things, obviously making it convenient to the patient, meeting them where they want to be met is really important. And then using those platforms to continue the engagement, right? How can we give them access to more health information? How can we make them aware of the activities that are happening within the center? How can we help prompt them at the right time and at the right moment for the interventions that will help them with respect to preventative screening, et cetera. So we use all of those channels in order to engage with patients. For those that are at sort of even more sort of on the edge, if you will, sort of high risk or likely to have a healthcare issue, we are employing other forms of technology, for example, in the home, in order to kind of monitor them on a more longitudinal basis. So it really is a full suite of things tailored to the individual patient, but opening up the idea that although we love to see you in person and we're trying to make clinics where people actually view it as not just I don't go there just for my healthcare, but I go there we also want to have other channels so that we can meet them where they want to be met.
All right, well, let's dive into something that was just in the news recently, and this is really cool because we understand that CenterWell recently had a pretty big announcement about leasing space in former Walmart health clinics. Can you dive into that a little bit? Can you tell us, what would you like us to know about that announcement? And we can dive into kind of how that's designed to help improve some of the care you're talking about.
What's so cool about the Walmart health announcement is actually sort of an acceleration of our existing model. So when we look at those Walmart health clinics, they look and feel a lot like the CenterWell senior primary care clinics that we have elsewhere in the country. So again, I mentioned we have around 300 of them across the country. We typically locate them in very accessible locations, right? We stay away from the massive medical office buildings, and we tend to put them in much more accessible retail locations near a supermarket, in the strip mall, where there's easy parking, easy access, and we build a footprint that is designed around the seniors, right? So we have the care areas, I mentioned already, the community rooms. These Walmart health spaces looked very similar. And so when we heard about the fact that they were sort of stepping away from their experiment in healthcare, we looked at the space and said, wow, we would have built these exactly like this had we had the opportunity. And oh, by the way, they're in some amazing communities that we haven't been able to have access to. We actually looked in some of those communities for the perfect space and didn't find it. And so we were actually really lucky to have these places in Florida, Georgia, Missouri, and Texas that allowed us to accelerate the model. I would say what also makes them different probably than what was happening there before is we're just bringing the CenterWell senior primary care model to those locations, right? So we expect that they're going to look and feel very similar. Same integrated care teams, same dedication to senior primary care, same appointment time. So it's really taking our model into an existing footprint. So what it did was it was a very capital efficient way for us to expand our footprint into communities that we were hoping to be in anyway. So really exciting for us. All of those clinics are sort of getting ready to open under the CenterWell banner and will be operational by the first half of 25.
What's your take on all this, James?
Well, I guess my question would be, without critiquing how Walmart went at it, they kind of pointed to two things that really were obstacles for them being successful. One was finding qualified staff. Obviously the talent shortage is real. And you'll face that too, I would imagine. But then they also pointed to reimbursement just being unworkable. Do you foresee the same challenges, or how is your model different? And how will that allow you to be successful where Walmart seemingly stumbled?
Well, again, I won't comment on the Walmart sort of model because I don't know that I know all the details. But again, what I love about the CenterWell senior primary care model is it actually helps address both of those issues that you just raised. The first on talent. I would argue that the CenterWell model of primary care, the value-based care model, is exactly the reason why people went to train in the first place, right? They wanted time with their patients. They wanted that opportunity to have longitudinal, long-term relationships. They wanted to focus on keeping people healthy and well. And they wanted to think about the whole person, right? They wanted to have an entire care team that took off maybe some of the burdens of things that maybe weren't at the physician or the nurse practitioner level to sort of help support the patient in other ways, allowed them to focus really at the top of their license, but to give the time and the space for them to really get to know things. And so what's been amazing about the story that we tell, and frankly, the story that now the providers are telling is, this is why I went to train, right? It's this model that actually makes this a fun place to work. And so, although I think that the clinician shortage is something we all have to be very cognizant of, especially in primary care, this model makes primary care more sustainable. And it's also sustainable for the other reason you said, which is financially, right? The fact is, when we look at our primary care base, all of our patients are either in a value-based care arrangement or on a path to a value-based care arrangement. What that means is the primary care practice is actually incentivized around managing the population, achieving very high level quality and experience thresholds, but also managing out unnecessary or low value care, right? So it's in no way sort of denying care, but it's rather, what can we do to keep you out of the emergency room because you can come into the office instead, right? What can we do to ensure that the referrals that you're getting are to the high value providers that are downstream, that the ones that are going to really focus on how do we get you better and are not incentivized maybe by doing surgeries that might be less valuable or associated with lower outcomes. And so what I love about the model is it's actually creating a sustainable platform to continue to grow primary care going forward because it aligns the incentives with what the primary care doctor really is the captain of the ship, if you will, with respect to healthcare for that patient is able to accomplish. So actually, our model, because we're kind of going in there with the pure play of like, we're going to use our model and just bring it to a different space, I think will help address both of those issues. Where I think if you were trying to serve all populations on a fee-for-service basis in hours maybe that didn't make sense, all of those things would be more difficult to be successful, whereas our pure play model makes it a lot more sustainable and durable.
To what extent does it also help that you're essentially what we would call a payvider, right? We're probably familiar with that jargony term, but you're both a payer and a provider of care to a large population of Humana clients. In that sense, you're akin to like a CVS Aetna or United Health. Does that also kind of improve the viability of what you're doing where Walmart didn't have that advantage?
I would probably say less so. And here's why. I would argue if you look at us, we are multi-payer, right? I already mentioned that we take original fee-for-service Medicare mostly because we're trying to move people along towards the ACO REACH program and some of the ACO programs being promoted by CMS. But we also work with multiple other payers on the Medicare Advantage side, right? And so we are part of this larger senior-focused ecosystem. If you look at Humana, they're actually the same way. They're multi-provider. They work with lots of other providers, including Oak Street, which is a part of Aetna and part of CVS, also with Optum, which is part of United Healthcare, and many other value-based providers that are really focused on sort of this paradigm of delivering on higher quality at a lower cost, so higher value care. And that includes those that are non-associated with payers and those that are not. And so we're seeing a really big spectrum of care. So again, I think what's more important to the story is that we've embraced value-based care. And we believe that is the model that will sustain us because it aligns our incentives, not so much with the payer, which it might in some ways, but really who it aligns our incentives with is with the patient. And that it's leaning into what the patient would want, which is, I want to be healthy and well. I want to be there for my family. I don't want to be in the hospital if I can be at home. And so by aligning ourselves with the patient and creating an incentive pattern that aligns with what they want, I think that's what's making it sustainable. And again, we're not alone. The statistics I shared with you on senior-focused primary care includes CenterWell, Conviva, the two brands that I work with, but others that are very focused on senior-focused primary care as well. So it's not a unique model. It's just fun to be able to scale it like we have.
Yeah, that's fantastic. And it makes me think of some of the areas to that point of how do we improve or just build upon the good parts of traditional care and add the other things that as we design new forms of care that we see are useful, things that are helpful. And we've been looking into some of those, what we'd almost consider adjacent areas that are more consumer-centered or just maybe haven't been traditionally thought of as healthcare. Everything from fitness to nutrition to weight loss for sure is, right. It's huge right now. But even mental health, you mentioned behavioral health. Are there some of those areas that make sense more for senior care that are like, those are things that we're incorporating or are looking to incorporate into some of the care that you provide?
Yeah, absolutely. In fact, I would argue it's all of them, all of the above, instead of picking just one, right? So if we just tick down the list of things that we believe are important, again, what I love about the value-based care model is it gives us the opportunity and the resources and the incentives to invest in these areas that under a traditional model, if they're outside the context of the 15-minute visit, it doesn't matter, right? And so what I love about the model is that it gives us that opportunity to think more broadly about the whole person. So fitness is one that we absolutely are focused on. Many of those community rooms that I mentioned will have the dance class or the fitness class and ways that we can kind of explain to seniors why it's so important to stay active. And so that is an important part of sort of the whole person care that we're providing. Food and nutrition is huge for us. We serve many communities. Our clinics are located in many underserved communities where food insecurity is not just a hypothetical, it's very real, right? And so we partner with other local organizations. We have clinics where we will provide meals. We have clinics where we actually provide food baskets of produce. We partner with local food banks. So we do other things that connect our patients with the resources in the community in order to address areas of food insecurity and just also sort of help explain what is healthy eating. How can cooking classes that help explain how a recipe doesn't have to be as hard as you might think, right? So that food and nutrition part is really important because of its health outcomes. But again, it also means they're engaging with the clinic more often and I guess lets us lay eyes on them that more frequently. Mental health is another huge one for us, right? So the senior population is not immune to all of the things that we saw, particularly coming out of the pandemic. I know the U.S. Surgeon General released a report that talked about the perils of social isolation, especially sort of during and after the pandemic. That is really important to seniors and obviously has a huge downstream impact on medical conditions. We know that chronic loneliness and social isolation can increase the risk of developing dementia by up to 50%. And so that connectivity that we can create for our seniors, both with respect to, again, the programming that we do within the clinics, but also having access to the behavioral health workers within the clinics and other behavioral health specialists out in the community is really important. We're actually working on some pilots with smaller companies to really improve that access. And that extends to other areas, both the traditional behavioral health, but also substance use disorder, right? So again, this is a population that you may not think about it every day, but substance use disorder is important in this population. If you don't have a solution for it, you're not taking care of that whole person. So all of those elements put together become that comprehensive care model that we're really working towards developing.
What else haven't we talked about in terms of how you're orchestrating this experience for care at home for seniors overall and connecting some of these dots? Like what haven't we talked about that's useful for people to understand about what it takes to make this happen?
I love what you just pointed me to. So I think, the provision of care in the home is really important to us at CenterWell. I mentioned CenterWell Home Health is one of the largest traditional home health agencies in the country, operating in 38 states. But what is really interesting and cool is when you actually think about primary care and home health as living under one banner and actually creating a care model in which you have teams that are thinking about patients, whether they're in the clinic or whether they're at home. And so it's, again, we're sort of probably in the earliest days of that model, but we have many parts of the country where the home health team will actually huddle with the primary care team on a regular basis, either daily or weekly, going over the entire census of patients who are accessing traditional home health services. That's usually, I need a nurse at home or I need a therapist home, like a PT or another type of therapy. those patients are really the sickest of those that are at home, right? Or the most tenuous with respect to the highest likelihood that they may end up having to go to the emergency room or the hospital. But by connecting those two teams and making sure that the doctor caring for the patient is in constant contact with the home-based team, we're able to, again, drive better outcomes, ensure that they're working in the same direction, ensure that the clinic is available for those providers in the home whenever they're needed. And it's just amazing the unlocks you can get when you have somebody laying eyes on a patient while they're in the home setting, right? So there have been just amazing stories of recognizing that the real problem here was the lack of a shower chair, right? Or the lack of the carpets being tacked down, or this patient could really use better stairs in the back of the house because the stairs, a little bit of work on those stairs would reduce their fall risk immensely. And so those types of unlocks, when you're really looking at the patient at home, are things that a pure clinic-based model will never see. We've continued to expand that. We now have community health workers associated with primary care that are really working with patients, again, out in the home, out in the community, sort of in tandem with the home health workers. So for us, it's, again, part of that whole person care that allows us to really understand what's going on with our patients and sort of connect them with other services or with other CenterWell services or external services that allow them to achieve their best health.
As we start to wrap, Dr. Shetty, I love thinking about just what gives us hope for healthcare in this country. What gives you personally hope for the future of healthcare?
Well, first, it's what we've talked about a little bit, right? It's this move towards value-based care. I think more and more organizations understand its power and its value. I hope that all parties, all stakeholders can get around this idea and continue to promote it in a way that is sustainable and durable so that we can continue to support high value primary care. But the fact that we have the proof points coming is really good, feels really good to me, right? Because it's going beyond the hypothetical into the real. We just have to find a way to continue to promote it. I'm also really excited about some of the technology changes, right? I don't think technology, as you pointed out, it's not necessarily even the really flashy stuff, but technology will be a huge unlock, right? To the degree it eliminates abrasion and waste within the system, but allows us to reinvest in patient care, I think is really huge. To the degree it allows us to connect ourselves better with our patients also will be really huge. So I'm excited for what that will bring if done in a way that is really patient-centered and focused and not just sort of focused on the problem, but focused on the folks that we're trying to care for. And frankly, it's the fact that the last one is just the continued sustained dedication of the healthcare workforce is also really amazing to me, right? So that always gives me faith. When I have that opportunity to hang out at the clinic a little bit and see the really great care that's happening every day, right? It's hard for me to believe this, but today, any day, we have 38,000 home visits happening at CenterWell, right? So 38,000 patients were seen in the home today to deliver better care. We are taking care of patients in 300 plus clinics across the country. Every one of those individual interactions, as much as I might sit as head of CenterWell, I recognize that the magic is coming from all of those individual interactions. And the fact that those folks come in every day and say, all I care about is doing right by my patient, that really gives me a lot of hope for what we have going for us. We just have to continue to build that workforce and invest in them to make sure that this is a calling for more and more people going forward. And I'm excited about the results, right? So again, what I love is that even though we just have a small sliver of the world in CenterWell, even for our Humana patients who are using CenterWell, we're seeing that patients who use CenterWell have lower levels of 22% lower avoidable hospitalizations. They have improved experiences based on their surveys. So overall, we know that we're creating something pretty special within the four walls of CenterWell, but we hope that we're part of a bigger trend to care for seniors writ large.
Last question, Dr. Shetty, and you've been so generous with your time. We see that you're very active on LinkedIn and social media, and kudos to you for doing that. I'd encourage our listeners to follow you because I think you're really thoughtful in how you use the platform. But are there influencers or thought leaders that you find value in paying attention to, whether it's on LinkedIn or just in the real world? And how might that inform Jared and I's decisions about future guests who would be equally as insightful as you've been?
In terms of influencers more broadly, there are a bunch. I'm blanking on any particular names. I should have some names. But I mean, for example, I'm friends with him, so I should be careful. But Sachin Jain is just amazing, all right, in terms of his ability to push the envelope in the conversation. So I've enjoyed having an opportunity to read his work. But I'd also, sort of tell you to look beyond that, right? There are probably folks who are very busy doing other things and not on LinkedIn all the time, but are accomplishing some pretty amazing things out there. So just to pick another Sachin who just popped into my brain is Sachin Gupta, who's running IKS Health. His company's probably a little under the radar, but doing some really cool things in how they partner with providers. And again, the reason I love it is it's very provider, patient focused, and it's all focused on some of what we talked about, using technology to improve things. So he'd be another person I would think about pulling in to have a conversation.
Great tips. And with that, that's a perfect place for us to wrap up this conversation. It's been such a pleasure to speak with Dr. Sanjay Shetty from CenterWell. Thanks for joining us today.
Oh, my pleasure. This is a lot of fun and look forward to continuing the conversation.